Hi, my name is Dr. Roxanne George, and I am your host for today's Radiant Health Dialogue series on breast cancer on HippocratesDocs.com in collaboration with Physicians Committee for Responsible Medicine. Today we have Dr. Irminne Van Dyken, who is joining us from Hawaii, and who is a plant-based physician and surgeon out there, and who is a valuable resource to our plant-based community and her patients, of course. So, hi, Dr. Van Dyken, how are you?
Hi, I am wonderful. Thanks so much for having me.
Well, thank you so much for joining us today. We see the beautiful paradise living behind you. It looks so beautiful. So we're excited. Our topic today with you is about the microbiome and how it can influence our health in general, but specifically for breast cancer. But before we get there, could you give us a little introduction on how you started into this type of lifestyle and, way of treating your patients?
Absolutely. Yeah. So thank you for the introduction. I practice here on Maui. I'm a surgeon, so that is like my main trade. So I do general surgery. I do trauma surgery. In my practice, I treat a lot of conditions that I very quickly found are preventable and or reversible with lifestyle. So, things that started out for me, breast cancer was one, something that I saw can really be reversed or prevented. In any case, once I started my practice with surgery, I noticed this, and I noticed that there were so many conditions that I was treating that really can be addressed before it gets to me. As a surgeon, you're kind of the end stage. People don't want to see me, so trying to treat it before you see me is a really lofty goal. I started doing some research. I created a talk called 10 Ways a Plant-Based Diet Can Help You Avoid the Scalpel, which was very popular. People love that. And then I just kept doing research on that. Personally, I've been vegetarian since I was 9 years old, and I didn't really think about being plant-based until I was in my surgical residency, where I started reading some research. So that was back in 2010. And I did some research and found out, hey, there's something to this. And once I applied it to myself and my family, I saw huge changes. And then applying it with patients and learning the lifestyle medicine aspects, the motivational interviewing and all of that, it's just, the returns have been huge. So I stress it all the time. All my patients come in, it's very rare when we do not have a discussion about something lifestyle related. So it's kind of my passion, and I really like to be a proponent of it.
Absolutely. And we thank you for taking that time and, taking that service with your patients. I know it's the returns, of course, make it worth it. I think we all, love to see that in our patients as well. So I am excited about this topic because the microbiome is, hot topic, right? Lots of things influence our microbiome. Our biome actually influences a lot of different aspects of our health. So really excited to unpack this even further with you today. So as far as just in general basics, could you tell us about what is the biome? Where does it live? Tell us a little bit about that.
Yeah, I would love to. So you're right. The microbiome is a huge topic, and you're probably going to get a lot of coverage on it, but it's for a good reason, because the microbiome is so important. If you take any human being and you look at the cells in our human body, we have quite a few human cells, but the microbiome has 10 times more cells than we do. So for every human cell that's lit on us that makes us who we are, there's 10 other cells that are microbes. So not only bacteria, there's fungi, there's viruses, there's protozoa. All of these make up who we are. And you think about the numbers, right? Hundreds of trillions of cells. It's hard to fathom that. You're thinking, oh, well, that's so many. How much is that? But if we were to take all our microbiome cells and weigh it, it's about 5 pounds of our overall body weight is cells, right? Microbiome. And this microbiome has been doing so much for our body. We didn't know much about it. Even 10 years ago, we didn't know much about it, but we're finding out that it dictates so much in our overall health. It's just phenomenal, to the point where some scientists and researchers are calling the microbiome like an essential organ, like its own system. So we're really finding out more and more every day, and that's exciting for sure. Within our microbiome, the majority, like over 90% of all the organisms, they live in our GI tract, in our gut. mostly our colon. So when we talk about optimizing our microbiome, most of the time we're talking about gut health, right? Taking care of our gut, making sure we have good bacteria in there. So a healthy microbiome is going to be one that's diverse. There's a whole bunch of different species of bacteria, fungi, protozoa, viruses in there, and they're good stuff. They help balance all these little things in our body. A bad microbiome is one that may have an overgrowth of one type of bacteria that is maybe not the best for our overall health. And there's so many little nuances. If you think of how complex this microbiome is, so many different bacterial structures, et cetera, and types. And we still don't know exactly what the function of each type is. And we're learning so much each and every day. But the things we do know, the microbiome needs to be diverse. We need to make sure we have a whole bunch of different bacteria and other organisms in our GI tract. So we need to do that. And we have strategies to do that. And again, we're learning more and more every day about how to do that and how to optimize it and what the best strategy is, but it is something that we're kind of dialing in. So the science is changing every day.
Yeah, absolutely. I think diversity, like you mentioned, is key. And how do we help cultivate that diversity?
Yeah, so diversity in our gut is actually a pretty direct reflection of diversity in what we eat. So if we were to eat the same thing every single day, it's probably not the best to get a diverse microbiome. You want to try to eat multiple different types of foods, specifically fiber. So when we eat fiber, the fiber, of course, it's not food really for us. It's more so food for the bacteria, for our microbiome in our GI tract. So the food that we eat, we need to think about and consciously pick what's the best food for my microbiome. And fiber, of course, is very, very plentiful in plant foods. Animal foods, zero fiber. And one striking statistic that it shocks me every time I think about it is that when you look at fiber intake, and Americans in particular, 97% of Americans don't get enough fiber. That's pretty scary. So yeah, so eating tons of fiber, trying to minimize foods that will do no good for you, which is zero fiber. So animal foods is very, very valuable to building a healthy microbiome.
Absolutely. Yeah. So we've heard a little bit about, in the plant-based world about how the biome influences our cardiovascular health risk, TMAO, and how, or eating certain foods can cultivate the wrong biome and increase our production of TMA, and then turns into TMAO, which can increase your risk of cardiovascular disease. How is it the biome influence estrogen and estrogen metabolism?
Yeah, so this is something that I love to research because, again, I treat a lot of breast cancer, and breast cancer and estrogen are so intimately intertwined. So yeah, let's take a dive into the microbiome and estrogen metabolism. It's actually called the estrobolome. So there's a name for it. It's been studied. We're learning more and more about it all the time. But essentially, what we're finding is that the microbes in our gut, they regulate estrogen metabolism very, very tightly. They are the ones responsible for the estrogen levels throughout our system, particularly when we're postmenopausal. So if you think about the setting of breast cancer, it's most common in women who've gone through menopause as opposed to women who are premenopausal. When you're premenopausal, your estrogen really production, it's dominated by your ovaries. But once you hit menopause, that goes away. So your estrogen production has different mechanisms of being dominant versus not. And the gut microbiome becomes more and more important at that point. So essentially what happens is we have gut bacteria, certain types that make an enzyme. Beta glucuronidase is what it's called. And this enzyme is actually bad when you think about estrogen. So when you have estrogen circulating through your body, circulates through your bloodstream, and it goes to the liver. And in the liver, it's actually deconjugated. So it changes. And once it changes, it gets excreted through the bile and into the intestine. So once that estrogen metabolite hits the intestine, that's where we see the magic happen. So usually we have bacteria that are going to bind to the estrogen and excrete it in the urine and in the feces, okay? But it's a tightly regulated system. So we have other bacteria that secrete this beta glucuronidase that actually changes the estrogen again to the point where it's absorbed back into the bloodstream. So that can be good, because if you think about it, we need estrogen. Everybody needs estrogen. It's something that's important to survive, but you don't want too much and you don't want too little, right? So this balance of bacteria is really important. If you have a situation where you have so much bacteria that create this enzyme that reabsorbs the estrogen, you're going to have really high estrogen levels in your circulation. And how does that relate to breast cancer? Well, over 70% of all breast cancers are estrogen responsive or positive. So that means they feed off of estrogen. So when you are a postmenopausal woman and you have high estrogen levels and you theoretically have, say, some breast cancer cells, you're feeding those cells directly. So that's why it's so important. In any case, we also know that we can manipulate the estrobolome. There are studies that show vegetarians have a lower incidence of this beta glucuronidase activity. So they have a lower incidence of this estrogen being reabsorbed back into the bloodstream. So they have lower estrogen levels postmenopausally. They also have higher excretion. So they've measured the urine of vegetarians versus omnivores, and the vegetarians have higher excretion. So what does that say for us? Well, if we want to have a healthy estrobolome or estrogen microbiome, we have to continue to optimize our microbiome and continue to try to do what we would normally to get a good microbiome, tons and tons of fiber, really trying to expose ourselves to situations where we have exposure to soil and microbiomes and things like that. So yeah, in a nutshell, that's the estrobolome, and that's how it relates to breast cancer. And I find it fascinating, to be honest.
Yeah, absolutely. I didn't even know there was a term for it. So that's really interesting.
Yeah.
Estrobolome.
The estrobolome.
That over our next dinner talk. So
there you go.
As far as, I find it interesting that the vegetarians have a higher excretion rate compared to omnivores. How do you think that works out when we're having, omnivores are eating kind of more animal products and maybe more dairy and cheese that are more estrogen, laden, or you would think would have higher hormone levels in them? Do they really talk about that?
Yes, theoretically, but I think the prevailing theory is the bacteria, the microbiome. So as a vegetarian, you theoretically are going to have a much higher fiber intake and cultivate, a different set of microbiome organisms than an omnivore. And these organisms are the ones that can bind to those estrogen metabolites and excrete them. So another really interesting thing is broccoli and cruciferous vegetables, right? We know there's tons of research showing cruciferous vegetables decrease risk of cancer, breast cancer in particular. Well, they looked at the estrobolome and they looked at broccoli. And they actually had a trial of women and they fed them broccoli, and you'd think it would be cups and cups and cups, but it was only 1 cup twice a day. And what they found is these women who ate that, they actually had way higher excretion of estrogen. So same thing, the broccoli somehow is influencing that microbiome to the point where the estrogen is being bound and removed from the system. So yeah, I mean, people don't like broccoli potentially, but mom was right. You got to eat your vegetables. It's very, very important.
Yes, absolutely. So what are some of the most detrimental things to, is it, if people cut out like this type of food, they will cultivate a better microbiome, or is it really like the fiber? Is it more take away or more put in, I guess is my question.
That's a really good question. And I think we're still finding out the answer to that. There was a study, which is very, very famous now, where they took a group of omnivores and then they took a group of plant-based people and they measured their microbiomes and their diversity and the ratios of good to bad bacteria. And then they switched them. So the omnivores became plant-based and vice versa. And they found the microbiome started to change within 24 hours. So very fast, and as a result of the diet. So is it cutting out or adding? It's hard to say. I mean, logically, and actually in that study, they measured the omnivores' fiber intake before and after they switched to the plant-based part of the arm. They measured the cholesterol, they measured everything else. And if you think about it, if you are an omnivore and you're eating food that is not fiber rich, et cetera, you can only eat so much in a day, right? So you're taking up this big proportion of food that you could be replacing it with plants, legumes, whole grains, stuff that is healthy for the microbiome versus does nothing and is potentially harmful, as you said, from TMAO and all these other chemicals.
Yeah, absolutely. Yeah. So I always try to think what people might think about or ask when I'm going through these interviews. And so, a lot of our patients, or a lot of people out there may want a pill to fix the biome. So as far as probiotics and our, the supplement industry, of course, has figured out that we can, package our biome, so to speak.
Well, they think they can package the biome. It's so interesting because, yeah, even a few years ago, probiotics, I mean, they were all the rage. It was what people thought the magic pill was to get the microbiome just how you want. And probiotics, they're not really panning out to what we thought they'd be. They're not that panacea that we thought. We know that taking a probiotic, it kind of is a temporary inhabitant of your intestine, and it can maybe in the long term help rehab a microbiome that is completely devoid of anything good. But if you are overall healthy, there's not really benefit to taking a pill. There's not benefit to taking a probiotic. There's much more benefit to taking whole foods. So whole foods are interesting in the fact that they're not only prebiotics, right? They are, they're not only probiotics, right? They're prebiotics, they're probiotics, and these all act together. So you have to think about the prebiotic aspect. There's so many foods that have, like, inulin is a famous prebiotic. Again, you want to get it in a bunch of foods rather than from a pill. It's going to be so much better in the long run. And then the last argument to that is the vegetables and the legumes and everything you eat, they're full of other things. So it's not just fiber. It's not just, this prebiotic. They're full of phytonutrients, chemicals that have other benefits that we know help overall health. They help lower inflammation. So it's all kind of cumulative. And all we know for sure right now, because everything is changing so fast, is that eating the entire food is way better than trying to isolate one little aspect and putting it in a pill. But I will tell you, you're right. I think there's a lot of pharmaceutical companies that are trying to exploit this and find a way to, get this magic pill, because yes, I think it would be very popular, and it's American and human nature to want an easy, simple fix, in the form of a pill.
Yes, we all want the easy way out, but it's not hard to just eat from the garden, right? Eat from, things that are grown. So I always say one of the coolest foods we can eat are fruits. They're right there.
Yeah, it's like fast food. Grab and go.
Exactly. Our new fast food. And so, in talking about prebiotics and probiotics, as far as, do colors like that, we know we have a lot of phytonutrients in our foods. Do you think that eating a variety of colors helps to cultivate that biome? I
think a variety of vegetables in general. And we do know that the brighter the color, typically the higher the phytonutrients. So bright stuff, like the purple cabbage is a better option, honestly, than green cabbage, because it's got more of those phytonutrients. So yeah, in a way, trying to pick the bright vegetables is really good.
Right. Absolutely. Always going towards those darker and brighter colors, eat from, the rainbow. But if we had to pick between lighter foods versus darker foods, usually the darker foods win out on that. So I agree.
Definitely. And this is kind of going on a little bit of a tangent as well. But if we think about our food also, where it's grown matters, and the soil that it's grown in and the manner it's grown in, it really does matter as far as phytonutrient content. If you look at a cup of spinach from, and there's a study on this, and I'm trying to remember the details, but a cup of spinach like from Michigan versus a cup of spinach from another place in the country, and their nutrient concentrations vary greatly. So that's always something to keep in mind too.
Yeah, absolutely. Another question that I often get is when talking about developing good biome, a lot of my patients will sometimes favor yogurts and kefir because they were always told that these are the ways to introduce good gut, bacteria into our systems. Could you kind of expand on why that may not be the most optimal way?
Yeah, no, that's a good question. Again, I do think that some of the water kefirs can be beneficial if you have a damaged microbiome. Again, it's usually processed. You go buy it in a jar, right? So you got to make sure there's no added sugars and all of that type of thing, because it can be much more of a problem. The yogurts, yes, they have probiotics, but again, there's other things with them, the dairy, the cholesterol, the hormones, etc. I just don't think it's worth it when you can get healthy food from a different source.
Yeah, absolutely. We always talk about the packaging. The packaging matters. You can still get that probiotics with healthier packaging.
You definitely can. And
Yep.
there's healthier sources of probiotics as well. So
Mhm.
one thing that's popular here in Hawaii is a food called natto. Have you heard of it?
No.
So natto is essentially fermented soybeans, and it's from Japanese cuisine. People love it. It's got a very distinct flavor. It's one of those things you either love or you hate, but it is more of a whole food, right? A whole food source
Sure.
for probiotics if you're really trying to get it from food.
Yeah, absolutely. So how does soy play a big role in breast cancer? Talking about soy. That was a good
Yeah, so
segue.
soy, I would say up until maybe 5 years ago was pretty controversial. There was two camps, right? And one saying, if you have breast cancer, don't eat soy. And another group saying, oh, well, do eat soy. And we didn't really know. The jury was out until recently. We had a huge meta-analysis that came back essentially saying soy is safe. So soy, the concern with soy is that there are phytoestrogens in it. So phytoestrogens are compounds that kind of mimic estrogen. They look like estrogen and they can bind to the similar receptors that estrogen does. And there was worry that maybe those estrogens, the phytoestrogens, could feed breast cancer cells. So that was a theoretical concern. Data has shown us huge studies. We've looked at Japanese women, we've looked at American women, we've looked at women who have all sorts of soy intake in the setting of breast cancer. And it's interesting, we actually found the opposite, that the breast cancer did not get worse. The breast cancer actually got lower. The chances of recurrence dropped the more soy that women ate. So soy, in my opinion, is very beneficial, especially if you have breast cancer, more so than even if you don't. I would have a couple caveats with that. Soy should be non-GMO. And when we talk soy, I'm talking like whole food soy. So we're not talking about soy protein isolate, that you find in granola bars or in, protein powder, that type of thing. No, that's not what we're talking about. We're talking about soybeans, soy milk. Actually, a lot of these studies were done with women drinking soy milk, tofu, tempeh. Some people say tofu's processed. I argue against that. I think it's very minimally processed. I still consider it a whole food. So yeah, that's a thing. And if you want to get into the nitty gritty science of it, the phytoestrogens from soy bind to a completely different receptor. So there's estrogen receptor alpha and estrogen receptor beta. And the breast cancer binds to one, the estrogen that feeds breast cancer, are estrogen, and the phytoestrogens bind to another. And so we're actually finding that how soy works so well is that the phytoestrogen binds to these receptors and kind of blocks so that our estrogen doesn't have a receptor to bind to. So many women who have breast cancer may be familiar with an estrogen blocker pill that the oncologists give them to kind of decrease the risk of breast cancer coming back. Soy kind of does the same thing. It's an estrogen receptor modulator. So it's important, and I recommend it.
Yeah, absolutely. I'm so glad you brought that up about the two different receptors. I always feel like that helps people understand the difference between a mammalian estrogen or human or, from whatever animal estrogen versus a plant-based estrogen.
Yes.
There's they sound alike, but they play a different role in our body. So I think that's really important to kind of
Absolutely.
decipher. But
and sorry, I'm just going to cut in for 1 minute too, and just emphasize that the soy and the phytoestrogens, in addition to that, with the soy, you're getting other beneficial things. You are getting other phytonutrients, et cetera. And the same argument, honestly, could be used for things like flax and that type of thing. You're getting lignans and other things along with the phytoestrogens. So it's all healthy at the end of the day.
Right. Yeah. Again, so many different factors that play into the protection and prevention of breast cancer for sure. So as far as our biomes, how would somebody know if their biome, isn't great? They're kind of walking around eating the maybe standard American diet. They say, I'm pretty good. I mean, how would they know? What would be some signs for them?
Good question. So if there's some people that are very data driven, and if you look on the internet, there are companies that potentially check your microbiome. You can send off a sample and they'll tell you how diverse it is and all of this stuff. And I think that science is in its infancy and it's not really reliable. Do I think that will get better with time? Probably. But for now, I don't think that that's the best indicator of knowing whether your microbiome is healthy or not. So we have to kind of turn inwards and look at our bodies, right? How are we functioning? How are we feeling? Are we having any symptoms of abdominal pain, bloating, nausea after eating? Those are all signs of an unhealthy microbiome. How are our bowel movements? I know some people don't like to talk about it, but for me, especially as a surgeon, I have to talk about it all the time. How are they? Are you having bowel movements every day? Are they good in size? Are you having issues with diarrhea? Is there any blood in there, mucus in there? Are you straining to have a bowel movement? Are you sitting on the toilet for over 3 minutes to have a bowel movement? You'll be surprised at some of the answers from patients. Sitting for 30 minutes at a time, waiting to have a bowel movement, which is not healthy, especially if you're talking about hemorrhoids and that type of thing, but it's not healthy. It's not a good thing. Taking your phone or a magazine to the toilet is not a good habit. It's all not good. So any of those indicators would tell me that there's issues with the microbiome. There's issues that can be improved upon, and it's not black and white. It's not like you have a good microbiome or a bad microbiome. There's a whole spectrum in between. And honestly, I feel like everybody can work on improving it, myself included, can work on improving it.
And I think it's reassuring for people to know that it can change so readily, as far as, eating salads or eating, those heavy saturated fats. I mean, it's so dynamic. And so knowing that it can change is helpful for people to know too.
True. And it's also, for me, the way I look at it, it's a little bit challenging too, because you kind of got to keep it up.
Yeah.
You can't get your microbiome and you're done. This is work you have to do the entire time.
Right. Right.
And one other thing that I haven't touched on yet is alcohol intake. So alcohol is actually it has a lot of influence on your microbiome, essentially, and it has an influence on breast cancer. So up until this year, most of the major organizations were saying 1 alcoholic drink per day for a woman is okay. That's not going to increase your risk of breast cancer. Now, this year, there are some major organizations that came out saying there is no safe amount of alcohol when it comes to breast cancer. So something to keep in mind, but also we know that alcohol changes your microbiome. It wipes out a lot of the butyrate, which is a chemical that's good and feeds your good bacteria and provides a protective layer on your intestinal wall. We know that alcohol intake has been associated with something called SIBO, which is small intestinal bacterial overgrowth. And that can present as abdominal pain, bloating, that type of thing. So yeah, if you want to improve on your microbiome, one really quick low-hanging fruit is to decrease or cut out alcohol.
And that includes wine? I'm just kidding.
It does.
That's the question I get.
Yeah, I know. And for some reason, the claim about wine with the polyphenols and all of that stuff, and that there's some good to it. I don't know. I all I can tell you is any study involving alcohol and breast cancer, no matter what the type, there's increased risk.
Yeah.
So It's kind of a carcinogen from a breast cancer standpoint.
Yeah, absolutely. And so we know, eating the right foods and fiber, and, we don't want to put alcohol in that system. What else can we do to cultivate and kind of, not let our good gut bacteria down? How can we help them thrive?
Yes. So this is a tricky one. Prior to the current pandemic, I used to be of the philosophy that we're over sanitized. Our entire society is over sanitized. You think about our homes and we're cleaning them too much, to be honest. We're showering too much. We're using like chlorhexidine soap on our bodies. We're using like antibacterial stuff, all the antibacterial soaps, the mouthwashes, it's all too much for our microbiome. And surprisingly, it makes a huge difference. You think about something as simple as mouthwash. If you have a mouthwash that has an alcohol component to it, you're actually wiping out a lot of the microbiome that lives in your mouth. And you think, well, that's good, right? Microbiome in your mouth, but it's not. These bacteria in your mouth help metabolize nitrates and get nitric oxide, which helps your whole body function. So you want to watch the mouthwash. You want to be careful about over soaping, no antibacterial soap in the shower. For me personally, I shower twice a day, yes, but I don't use soap, only on certain areas that can get dirty and smelly, right? The rest of it is really just a rinse off, washing hair once to twice a week max, that type of thing, because the soap really can wipe out those healthy bacteria. So you want to kind of have a climate where you don't have bacterial overgrowth, but you don't want to have a sterile area either. So it's a bit of a trade-off. And, you know, now with the pandemic, that's more difficult, right? So we do need to be washing our hands. We have to, there's no doubt about that. So it's one of those things.
Yeah, absolutely. I know it has gotten a little bit more complicated with all this going on. And could you go into a little bit about exercise and how that influences? I mean, is there a certain level, like too much stress is, we know, bad for our biome, but exercise is kind of like that good stress, right? That may help cultivate it.
Yeah, so exercise, it actually helps, you know, increase that short-term inflammation, which is really good from a microbiome standpoint. From a total body inflammation standpoint, it's good. Too much exercise can be too much. Obviously, it can cause chronic inflammation, cause your body to get overstressed. So there is a balance when it comes to exercise. As far as exercise directly relating the microbiome, I don't know of any study that's particularly looked at that and what amount would, you know, result in the best, most healthy microbiome. I don't know that.
Right. Yeah. There's to be determined, I guess, on the specifics on that. But for overall health, definitely important to move and, you know, help our bodies stay kind of, you know, a body in motion stays in motion. I always like to tell patients that.
Absolutely. And one thing that I want to mention, just in the setting of breast cancer, exercise is huge. So huge. It's to the point where we have really good studies showing that breast cancer patients, once they go through their original treatment, if they're on an exercise program and a lifestyle program, their chance of recurrence, so the cancer coming back, drops, sometimes even by 50%. It's huge. So exercise, super important. And if you look at it too, from a standpoint of body type or body size in breast cancer, we know obesity is linked with a higher risk of breast cancer, but we also know that being underweight is linked to the higher risk of breast cancer. It's like a U-shaped curve when it comes to risk. You know, you've got underweight, so BMI, which is a pretty crude measure, but it's how we measure stuff. BMI under 19 or 19 or less, and then you've got obesity. And those two ends of the spectrum are not a good place to be in. So when you think of things like body mass, if you are underweight, we got to pack on the muscle. There's no other way about it. There's actually very good studies showing that muscle mass is directly related to survivorship in breast cancer. So we need to make sure we get muscle mass, no matter which end of the spectrum you're on, honestly.
Right. Yes. We always have, there's I forget who termed the phrase, but, you know, even if you're thin and you're trying to gain weight, it doesn't give you sort of carte blanche to be eating, you know, McDonald's, French fries and burgers, right? Even though you're not packing up pounds. It of course doesn't help your biome or your, you know, other, factors in developing disease. But as far as, I think it's important point you made as far as bringing up your muscle mass, you know, you want to work on building your weight that way through healthy foods. And then, you know, working with like resistance training, I think would be important. And women sometimes are afraid of resistance training. And, you know, so that's an important way to, you know, prevent and then also help with treatment of breast cancer. So thank you for bringing that point up.
Absolutely. And then also, you know, resistance training. So we think of like weightlifting and that's the typical thing, but weight bearing training is also very beneficial. So, you know, whatever activity you like to do, the running, anything where it's weight bearing is going to help with that.
Yeah, absolutely. So we're running towards the end here, but I wanted to kind of get your final thoughts and, you know, what you can, you know, the one line of information or that one thing you want to have patients to take away from all this.
So for me, the takeaway from all of this is that, you know, this information that we talked about today should be empowering. It should be something where you have the tools and the information now to help yourself, to really help in the setting of breast cancer, either whether it's preventing it or decreasing risk of it coming back. And that's an important thing too, that I really want to emphasize is if breast cancer unfortunately has happened to you or your family, it's not too late. It's never too late. There's always time to turn it around. There's hope. There's empowerment in knowing that you can do this and be a stronger person at the end of the day and have, you know, decreased risk across the board. So this is by no means a guilt trip or pointing or anything like that. This is hope. This is empowering, and that's the way it should be.
Yeah, absolutely. I think sometimes, you know, we physicians kind of you know, as a whole, sometimes are so focused on treatment and medications and, you know, how do we get you, you know, better with our modern medicine. But I think it's great for people to know that there is so much at their own fingertips that, you know, can change things so dramatically and so quickly.
Mm-hmm.
So thank you so much for being with us today, Dr. Van Dyken. I really appreciate your time and letting us see your beautiful backyard there. That's
definitely
fantastic, out in Maui, Hawaii, correct?
Correct. It's beautiful. If you can come visit, any of you come visit. We have paradise here.
Yeah, it looks like it. I love it. So if people want to get in touch with you or find out more information, if they're in Maui, how can people reach out to you?
Yeah, so the best way, honestly, is YouTube. My husband and I started a YouTube channel. It's called Out of the Doldrums. We are sailors, so that's why it's called that. But we do a lot of health-based stuff there. It's a good way to see us, to kind of see more what we're about. Got a whole bunch of videos on the microbiome and overall plant-based health. So that's a good venue. On social media, you can direct message, same name, Out of the Doldrums. We're there. And that's the easiest way.
Mm-hmm. Okay, well, great. Thank you so much for spending this time with us and being such a huge resource to your patients and this plant-based community. We look forward. I'm definitely going to be checking out your YouTube videos. That's awesome that you guys are put those together. And we hope to talk to you again soon.
Sounds good. Thank you so much for the time.
Thank you for being here.
Mm-hmm.
Take care.
Yeah.